Dr. Debra Luftman is a practicing dermatologist in Beverly Hills, California, and is clinical faculty in dermatology at UCLA Medical School.
Now, some tips for a healthy complexion. A prominent dermatologist answers your questions in today's edition of Ask the Doc.
I'm Dr. Debra Luftman at Vera's Retreat in the Glen, discussing some common skincare questions.
She has been featured on Extra as the dermatologist for Ask the Doc and Star Beauty Secret segments.
There's a lot we can do for this. The most common cause of these broken blood vessels is sun damage. The next most common reason would be hormonal reasons. As far as treatment, we might want to start with just cauterizing some of the individual vessels or using laser to vaporize those vessels. If you have a number of vessels on your face, you can do something called photofacial, which is a high-intensity light treatment.
Dr. Luftman obtained her undergraduate degree at UC San Diego and St. Andrews University in Scotland.
Well, that's a big problem for a lot of men. Really just starting off with a good shaving gel or cream on moist skin, and then using a disposable razor that you don't reuse more than 2 times is very helpful in preventing this. If you were to develop some of these ingrown hairs or bumps, just getting a 1% hydrocortisone over the counter and applying that twice a day will help alleviate the bumps.
I thought acne was only for teenagers, but I still seem to get the occasional breakout. Is there anything I can do about that?
This may actually be adult acne or acne rosacea, and the cause of acne rosacea can be genetic, and certain foods can make it worse. So going on a special diet can be helpful, and also there's a prescription cream that can help quite a bit.
For Dr. Luftman's tips on which foods you should avoid to eliminate acne and other skin solutions, just go to our website.
Her clientele includes celebrities as well as everyday extraordinary people who want to achieve healthy, beautiful skin. She was also the consulting dermatologist for skincare and non-invasive procedures on the Fox show, The Swan.
But Cindy is eager to begin her transformation. Her next stop, the dermatologist for laser hair removal.
I'm really excited about the hair removal, knowing that I'm a woman and I'm here with an electric razor having to shave my face every day. It's not a fun thing to do.
A lot of your hairs are here on the jawline and the cheeks. We're going to need to shave that first, then we'll go over with the hair removal.
Next time I'm looking in the mirror, I'm going to feel like a woman.
Good evening, fabulous experts. Dr. Luftman, Cindy used to shave her facial hair with a razor. How did you get her over that?
She was shaving every single day and found that she would even have that 5 o'clock stubble. Now that she's had laser hair removal, she wakes up stubble-free.
Dr. Luftman, BOTOX, very safe.
Very safe. There really is no downtime with this procedure. There's no cutting involved. It's just a simple injection.
It's for BOTOX and collagen injections.
Collagen is mostly used for the lower part of the face, including the lips. Right. BOTOX, real name is botulinum toxin, that is injected into the muscles. And by doing that, it paralyzes the muscles for a period of time, usually about from 3 to 6 months.
A few days later, most of these moms believe paid off.
Her medical degree was from Tufts University in Boston, and she received her postgraduate degrees in both internal medicine and dermatology at UCLA. Along with her featured sequences on Extra and The Swan, Dr. Luftman is often called upon for her expertise on both local and national television, including the 2002 Oscar edition for Good Morning America, Glow on E! Network, Discovery Health, Lifetime TV Network for Women, and the Oxygen Network.
Just walk me down the line and show me what you did to each person who's here.
So Debbie had BOTOX, and you can see she had very deep lines in here. She still has a little bit of lines here, but they've really relaxed. And then her crow's feet have really gone away, and it's opened up her entire eye.
And how about Christina?
Christina also had BOTOX, and she had 2 lines here, as well as forehead lines and crow's feet. And she had what we call a little bunny nose, where she had a little line here, but that's gone away. And Linda had BOTOX as well, and her lines were also treated, as well as her crow's feet. She had the BOTOX, and she also had photofacial or intense pulse light treatment around her eyes and her mouth.
Now, what could be more LA than that? Dr. Luftman, thanks very much. Good to have you with us. Good Morning America will continue.
It's time to focus on that fragile area between your neck and your bust line. And believe it or not, we've even found simple solutions to getting this area smooth and sexy. According to Los Angeles dermatologist Debra Luftman, the 3 biggest issues patients have with the skin on their chest are breakouts, sunspots, and wrinkles.
Chest blemishes are caused by an increase of sweat collecting in those follicles, the hair follicles in the chest. The over-the-counter products that you can use to combat acne are exfoliants, and exfoliants can be either mechanical exfoliants or chemical exfoliants.
Chemical exfoliants are products containing glycolic acid, like Dr. Luftman's Gentle Cleanser.
A loofah sponge is a great way to physically exfoliate the skin to get rid of that dead skin, to open up the pores. The dermatologist can prescribe oral antibiotics or prescription topical antibiotics, which can be very helpful, as well as chemical peels. The second largest concern my patients have are sunspots, and sunspots can range from the neck all the way down to the chest. Luckily, there are some over-the-counter solutions for sunspots, and those would include products with an ingredient called hydroquinone. These are actual bleaching creams, and they do lighten these melanocytes or pigmented cells. The third challenge that my patients have are wrinkles, and wrinkles can form really around the neck area, down into the chest, and between the breasts. Retinols can increase the collagen production of the skin, tighten the skin, and firm up the areas where the wrinkles were. This product by Avon is a breast firmer that works with plant extracts. If you use this every day, during the time you're using it, you may have some firmness, some kind of glisten to the skin. If you stop using it the next day, that will go away.
Dr. Luftman is often featured in newspapers, including the New York Times, USA Today, and the LA Times. Beauty magazines frequently quote Dr. Luftman on the latest skincare and cosmetic procedures. These magazines include Vogue, Allure, InStyle, and W magazines.
Dr. Debra Luftman is a dermatologist in a city many view as the beauty capital of the world, Los Angeles.
Okay, you ready?
She offers all the cutting-edge skincare procedures like BOTOX, collagen, photofacials, and chemical peels.
The procedures are mostly under $500. Compared to the $6,000 facelift, it really is more accessible to the general population. Okay, I have you frown for me.
By far, the most popular request is for BOTOX.
BOTOX injections treat the lines in the upper third of the face by relaxing the muscles that cause these lines. They feel comfortable with it. That's it. Soft form can be used in various areas of the face. Not only what we call the nasolabial lines, which are those lines from the nose to the mouth. They can also be used to correct the lip line. They can also be used in what we call the marionette lines, which are the lines that go down from the mouth to the chin.
But cosmetic dermatologist Debra Luftman warns that soft form implants aren't for everyone.
Usually a one-time implant with the soft form, and then it will stay there. And so you'll have that correction, that full correction for a long period of time.
The doctors mark the spots where the implants will go. Since the 6-inch implants are longer than the wrinkles, the doctors snip off the extra. After tucking in the ends, they sew Rosie up. The 20-minute procedure is repeated on the other side. Rosie enjoys instant gratification.
Part of the improvement is the swelling that she has from the anesthesia, but she really has pretty great correction at this point. Her furrows were not exceedingly deep, but they were obvious, and now they no longer are apparent. I think a lot of women focus on their hands, and when they meet people, they shake their hand, and it bothers them when their hand does not match what they look or what they feel like.
Vaporizing the top layer of the skin.
It does feel like a sunburn in a sense, and that's what she's going to find after the next 48 hours, a sunburn sensation and a little bit of redness.